So there are two diseases, guys, that affect third world countries, and that is because of osmolarity. So osmolarity of the blood, when the osmolarity of the blood is too high, what is happening? Osmolarity of the blood is too high, what is happening?
Water.
The water does what? There's a water in the tissue and water in the bloodstream, right?
Water.
So when you have too much osmolarity on the bloodstream, what is happening? Osmolarity means what? Pulls the water, right? So it's going to pull the water, right, out of the tissue. So that means that the bloodstream absorbs too much water because you have too much osmolarity in there, correct? So in patients that have high blood pressure, the blood pressure that we're talking about is what? High blood plasma pressure, right? Which is the hydrostatic pressure. Are you guys following? So the plasma is the water, right? So we call that pressure hydrostatic pressure. When a patient has a high blood pressure, the hydrostatic pressure increases, and that is going to push the plasma or the blood into the actual what? Tissues, correct? So they tend up to have a reduce on the intake of salt, right, in the diet as a way of balancing the hydrostatic pressure, because the more salt, the more water follows it, correct? So almost all hypertensive individuals, they do a diet with a low salt diet, correct? If they cannot do the diet, what do?
Oh, you take the
Medications. You give them medications, right? Okay. Which is medication, it depends, but you know, you have furosemide, or torsemide, or ethacronic acid. You have other medications. We're going to talk about these medications when we get to the urinary system. Okay. But everything is related. So everything is going to be built on the previous chapters. So you're going to see again endocrine, you're going to see again blood, you're going to see again cardiovascular system again on the way to the end. Okay? Because it's building all the system. Every single system, think about it. Every single system on organ requires what? Hormones. Every single system on organs require what? The heart to pump the blood, right? Blood vessels, and oxygen, and red blood cells, and white blood cells that are found in there. So we're going to see most of these things again. Okay? So if the osmolarity on the blood drops too low, then a lot of water will tend to remain where? In the tissue. And now the individual will become what? Edematous, which is swollen. What's the example? Kwashiorkor and marasmus. So kwashiorkor is a protein deficiency, means that these are third world country kids, that they have enough amount of calories, but they have low amount of what? Proteins in the diet. So the osmolarity is decreased, so almost all the water component of that blood or the plasma goes in the interstitium. So you see that they look like they're fat, but they're not, even though because they have big bellies doesn't mean they're fat. Yes? That's kwashiorkor. The other thing about it is that since they have low amounts of proteins, these kids will have these typical things. Look at that hair.
Oh.
You look at the hair? Normally, what is the normal or the predominant hair color? Black. For African Americans, most of them are black. Okay? That's what color?
Yellow.
They dye the hair, they want to be hip. No. That means that since they have so much low protein deficiency, protein is required to do what? To create
Yeah, because hair is
hair. So keratin. So since they don't have enough, you are going to see that the hair starts to do what? Change color. If you see a change in color in a pediatric patient, right, or a toddler, and it has some sort of features, what do you think? Child abuse.
Yeah, 'cause why
That is a protein deficiency, right? That means that mommy is not giving sufficient amount of food for that baby or that toddler so it can have proper amount of pigmentation and hair. Does that make sense? Or you can ask your mom, hey, have you dyed the kid's hair? I mean, I don't think mama usually do this, right? Yeah, I will be surprised, but usually that's not the case. So if you believe that mom does not take care of the baby and you see that there's color change in the hair of the baby, automatically that tells you this what? Child abuse. By what? By neglect. What is they're neglecting? Nutrition. They're neglecting care to the child. And that needs to be reported right away. This is going to be for all of you on your life. Okay? If you work in a hospital or if you work in any setting, right? With humans, you need to report this. Okay? This is a serious matter. A kid's life can be in your hands. Okay? So let's wash our core. And that is a protein deficiency. Low osmotic pressure. Okay? So, form elements. We said that blood is composed of what? Plasma and form elements. Plasma is the water component, and the form elements, I believe, is the thing that has a form inside, right? What gives some sort of form? I believe that the red blood cells have form. So erythrocytes have form. So form elements. So what are the form elements? Your red blood cells, your white blood cells, and your platelets. Okay? Everybody got that? So let's talk about the red blood cells. Red blood cells constitute about 99.9% of all form elements in the blood. So what is the most predominant form element in the blood? Red blood cells or erythrocytes. You have to be good with synonyms, guys, for this part. So normally, how many red blood cells does a male possess? About 4.5 to 6.3 millions. Okay? A female, 4.2 to 5.5. Wait. What is that? Why is this more in the males and less in females? Size. Most of the time, males have high levels of testosterone and growth hormone, which codes for what? Bigger bones, bigger muscle, bigger size, right? More tissues. More tissues, more oxygen, more nutrients, more red blood cells, more blood is required. Does that make sense? Okay. So, what is hematocrit? Hematocrit is a packed cell volume, right? Packed cell volume of what? Of red blood cells. Okay? That's your hematocrit count. Again, normally we looked at the hematocrit count is about 40 to 54% and 37 to 47%. Again, this is because of the what? Highest in male because of the testosterone, the growth hormone, okay? Because they have high number of tissues, high oxygen demand. Okay? So what is the hematocrit? The percent of red blood cells in a total amount of blood. Okay? Because blood is not only red blood cells, right? It's plasma, white blood cells, platelets, right? And the red blood cells. So that's what a hematocrit is. Normally, how long does the erythrocyte last for? 120 days. How much is that in month? So 120 divided by 30. One number multiplied by 3 gives you 12. All right, so somewhere around there. So just around 4 months, right? All right. So 120 days, that's the lifespan of your red blood cells. Now, red blood cells, one of the main things that I want to point out here is that, and it's not staying here, is that we use the hemoglobin A1C, which I'm going to talk about later, but you know me, I'm desperate. So what is hemoglobin? Heme is the iron, globin is the protein. So it's an iron bound to a protein that is found inside the red blood cell. Okay? So you have different type of hemoglobins. Whenever you hear the word hemoglobin A1C, what is that? you automatically think about what? Diabetes. So what is the marker for diabetes? They check for hemoglobin A1C. This one allows you to do what? To check for about 1 month of how the patient has been dealing with his diet. So you can go to the doctor and says, doctor, you know, I always take my insulin and I always eat things low in sugars and I do my proper exercise. The doctor's going to say, I believe you. He's going to send for hemoglobin A1C. And if your hemoglobin A1C levels are higher, the doctor's going to say, I'm sorry, the labs do not agree with what you said. So I believe you, but I go from the labs. You get it? No other way you can do this. So you can go to the doctor and say you can take the medications. There's no way to prove it, at least for not all of them, right? Unless you still haven't been proved. Okay, so that's hemoglobin A1C. So hemoglobin, how much of that is required to be inside a red blood cell? So hemoglobin is about 97% inside the red blood cell is made out of hemoglobin. Hemoglobin is the one that allows you to transport oxygen and CO2. How much is the affinity of oxygen and CO2? Which one has the higher affinity for hemoglobin? Oxygen or CO2? What do you think? Before you answer, think about these two things. What do you need? Oxygen. What do you need to get rid of? CO2. So, what of the two, oxygen or CO2, would you think is going to have higher affinity to hemoglobin? Some people and everybody will say what? Oxygen. The truthness of the fact is, as you build a high amount of CO2 in your body, every single chemical reaction, you need to assure yourself that you need to get rid of it, because it's not, are you an aerobe? No, you are a aerobic, not an anaerobic. Does that make sense? So the CO2 will have 20 times greater affinity to hemoglobin than the actual oxygen. Test question. CO2 has 20 times more affinity to hemoglobin than the actual oxygen. So one hemoglobin molecule can actually bind to what? 4 molecules of 4 molecules of
oxygen.
Or CO2. All right.
Oh, so the same amount.
Now, since we're talking about hemoglobin, we said it's about 97%, right? Can a red blood cell do its function without hemoglobin? Okay, you get it. So there's different type of hemoglobins. There's hemoglobin S. Hemoglobin S is for what? Sickle cell. And if you look here, this is a normal red blood cell, and this is a what? A sickle cell. What is a sickle cell? When the cell forms an abnormal shape of the red blood cell, which is supposed to be oval shape, biconcave disc, it forms a half of a cell with sharp edges. Are sharp things good for our life? Sometimes you're going to cut something, right? So red blood cells normally are inside what? The blood vessels. If you have sharp edges, means that they can encounter into one turn, they can just get lodged there. As the red blood cell gets stuck into one of the small capillaries, so let me say a red blood cell gets stuck, what happens? There is no what? Blood flow. So that means that this tissue right here will suffer from what? Ischemia, which is a what? Low oxygen content. That's what ischemia means. That means through a long term, or through after a minute or so, that tissue will become what? Or start to decay, or become what? Necrosis. It's going to start to die. So if you don't provide your tissues with oxygen, the tissue is going to die, And once it starts dying, it becomes what? Necrotic. Okay?
All because of the sickle cell?
All because there's something occluding the blood flow. So sickle cells, what do? They increase the frequency or the chances of getting what? Blood clotting. Everybody got that? Yes? Okay. Now the next hemoglobin that we're going to talk about, oh sorry, let me finish the hemoglobin status. Which is the most predominant individuals that suffer from sickle cell? What race? So high frequency in blood clots, race? African Americans. You're right. Let me start doing it right, because every book says that. African descent. Okay? How many of us came from Africa?
Didn't all of us come from
All of us came from Africa. All right? So one of us, some of us, maybe more closer to the African descent, but we all came from where? Africa. Okay? So this is just about traits. Now, if your mom has sickle cell and your dad has sickle cell, you have a 50-50 chance of getting sickle cell. Sickle cell comes in different traits. I'm not going to go into the genetics, but if you're dominant, if you're homozygous for the sickle cell trait, that means what? You are not going to last for more than 15 years. Because you're going to have a lot of recurrences with blood clotting through your life. If you're heterozygous, means you have part of a sickle, the other part is not sickle, you may last for a long period of time. All it is that sickle cell becomes sickle only when there is stress in the body. Means what? High levels of CO2, low levels of oxygen, or low nutrient. Right? Anything that gives you stress. Everybody got that? Yes? All right. So actually, I have a experience on this one. One of my good friends, he died while he was doing surgical residency. Okay? Because of this, of the sickle cell. That was from one day to the next. He got multiple blood clots all around, and he ended up having a pulmonary. Right? Massive clot. Okay? And then he passed away within less than 72 hours. That sucks. So you have to be sure, or at least know, if you are sickle cell, and try to not to be. So if you have a kid with sickle cell, it's okay. Right? Just got to deal with it. Make sure that they're not in any competitive sport. If they're in competitive sport and you start having this issue, then you have to take them away from there as a side event. So hemoglobin, you have hemoglobin A and hemoglobin B. Hemoglobin A comes in two flavors, hemoglobin A1 or hemoglobin A2. That hemoglobin only, or most of the time, is found mostly where? In adults. You also have another hemoglobin, that is hemoglobin what? F. F is for what? For fetus. Fetal hemoglobin is found mainly in what? Not babies. Babies when they come out. They're inside mom's womb, right? So fetal hemoglobin is the more predominant in fetus. Does that mean that fetus do not have hemoglobin A? No, they do have hemoglobin A, hemoglobin F. Does that mean that a toddler doesn't have hemoglobin F and hemoglobin A? Yeah, they should, but mostly it's hemoglobin A. Does that make sense? Why is hemoglobin F so important? Hemoglobin F has a higher binding affinity to oxygen than the regular hemoglobin A. If you think about this, if you're a fetus, where do you get oxygen from? The lungs? Which lungs? The baby's lungs? No, the mom's lung. Oh, what? So mom needs to get the air, right? Lungs get all the oxygen to mom's body, and then the last thing is to get oxygen is going to be what? Babies. So that means the baby red blood cell needs to tightly bound to whatever tiny amounts of oxygens are there, so you can take it into the body. Does that make sense? So fetal hemoglobin has the higher affinity to any of the other hemoglobins together. Does that make sense? All right. So heme is what? Iron. Globin is what? Protein. Here you can see that you have 4 heme groups, right? I just colored there for you. So heme 1, 2, and 3, that means that for each molecule of hemoglobin, there's 4 heme groups, right? That means you combine 4 molecules of oxygen or CO2. Everybody got that? That's what we said at the beginning, okay? When they do a blood test, they check for the amount of what? Total red blood cells, hematocrit, and hemoglobin. Okay?
When you do blood work, can you ask to see if you're sickle cell prone?
You need to have a prescription from your doctor. There's no point of asking for this. It's more money on the lab. If you don't have anything.
I mean, if it's more than 15 years, not a problem.
If you tell them your genetic background, then probably can persuade them to send it, but not usually. You cannot say, oh, do this or do that. No. So hemoglobin on adult male, the hemoglobin is 14. In adult female, the hemoglobin is lower. Why? Since the red blood cell is lower, that means your hematocrit is lower, your hemoglobin is lower. Does that make sense? You have less amount of red blood cells, right? So hematocrit is the number of red blood cells on the whole overall plasma. So hematocrit is low. Hemoglobin is based on the amount of red blood cells you have. So since you have low red blood cells, you have low hemoglobin. Lower. Okay? So fetal hemoglobin, what is so important about it? We said that it has a higher binding affinity to the oxygen, right? And that is because the fetal hemoglobin possesses what? What? BPG, biphosphoglycerate, or glyceride. So 2,3-BPG is what allows the fetal hemoglobin to bind higher to any oxygen molecule. So please make sure you know that. That's a test question. So what makes the higher affinity to hemoglobin F? 2,3-BPG. So now we're going to go into the whole cycle of the red blood cell. Ready? So, how are we recycling? Who's the best recycler in the world? Who's the best recycler in the world? You are. All of us are. Because our body, it maximizes, every one of us is the best recycler in the world. All right? Because it maximizes everything that we need and everything that we use. Your body does not waste anything as waste if it cannot find a good use for it. So this is one of the examples. First of all, we said that you have your red blood cells, which are about 120 days, right? That's pretty much the half-life of the red blood cells. Some of them are longer, some of them are shorter, more or less, but 120 days. As your red blood cells gets older, what happens? Guys, every single cell has a what on the outside? A cell membrane. Every single one of us have a skin, kind of like a cell membrane, right? As we get older, what happens to our skin? Gets wrinkly, gets harder, less elastic, correct? The cell membrane of the red blood cell, as the red blood cell reaches the 120 days, is going to get what? Harder, less elastic. Your red blood cell needs to go all the way through tiny capillaries that allows only one single red blood cell to squeeze all the way through. That means you have to go in this position instead of walking, like crawling. As you get older, can you crawl? Well, you can be on the floor, but that's it. You can't stand up, right? So as the red blood cell gets older, it's going to get rigid. So as that is happening, where is this going to take place? So rigid and becomes fragile. As the red blood cell goes into your liver and in your spleen, it's going to encounter what? Macrophages. Whenever a macrophage sees that there's a red blood cell stuck somewhere, again, do you want to stock red blood cell in one of your tiny capillaries? If it gets stuck, that means it's the same thing as sickle, right? You increase the chances of getting what? Ischemia. Okay? So the macrophage is going to find it, is going to engulf it, eat it. Again, where do you find macrophages? Spleen, liver, and including even bone marrow, right? But mainly on the liver and the spleen. As you engulf the red blood cell, as you can see here, what is happening? There are two fates of it. One is that you break the red blood cell into the heme group, and you break it into the amino acid group. What is the amino acid that we talked about? We said it was called what? Hemo?
Globin.
So the amino acid is the globulin, right? The globulin protein. So as we break down the globulin, that gives you the amino acid. What is the fate?
The red blood cells make plasma.
What is the fate? The fate of the heme is to be recycled and transported back through transferrin. We're going to talk about that later. Transferrin, like a car that just drives iron. So it transfers all the way that iron into your what? Into your bone marrow. Your amino acids are going to be used by your bone marrow. Wait, so I'm using again my iron and my amino acids to make a brand new red blood cell? Yeah, that's why I said you are the biggest recyclers in the world, the best ones. We are. Okay? So recycle both the amino acid and the iron. Where do you make red blood cells? You make it from your bone marrow. Which bone marrow? You got two bone marrow, guys. What are they?
The red and yellow one.
So you got bone marrow that is red or yellow. What do we want the yellow to be? Tasty, that's just fat. Energy storage. The red is the one that makes what? Your red, your white, and your platelets, right? That's the one that we care about. So that's where this thing is happening. Now, as a byproduct, like everything, right? When you recycle, there's always a byproduct. Something that you cannot use. So as byproduct, and your body does it, use it. So as a byproduct, when we're getting rid of the iron, in the case of the heme, what is happening? Iron gets oxidized and becomes biliverdin. Biliverdin gets oxidized and becomes what? Bilirubin. Okay? What is biliverdin? Have you ever seen biliverdin in your life? Have you ever gone to a place and did this? And then now you got what? A bruise. The bruise, first about the bruise is what? Pain. And if you actually break a lot of capillaries, it becomes red. And then that red color, which is the blood, right? And then becomes oxidized and becomes black, right? Or dark brown. Well, it's actually black and then dark brown as it gets oxidized. And in that between, it goes into a lighter fade of brown. Then it becomes greenish. Then yellow and disappears. Well, the greenish is from where? Biliverdin. Okay? The bilirubin is actually used like Juan Luis Guerra, la 440. So bilirubina, whatever. There's a song about it. So it's a Hispanic song. Anyway, pretty good song. Anyway, so bilirubin is actually what? Bilirubin is used by the liver. Okay? Bilirubin is used by the liver to, later on we're going to talk about it, and that is to be used as micelles that are going to absorb the fat. Okay? And then as bilirubin is in the liver, of course, bilirubin can be either conjugated or unconjugated. Means before the liver, any excess of bilirubin that you have is unconjugated bilirubin. Any bilirubin that is being processed by the liver, we call it what? Conjugated. Useful or non-useful? When they check for bilirubin levels, when the doctors ask for bilirubin levels to see if you have a liver problem, they check for liver enzymes, right? So not only the enzymes, but they also check for the bilirubin levels. If your unconjugated bilirubins are high, what does that tell you? What does that tell the doctor? Whenever your bilirubin levels, you have a high bilirubin, but most of the bilirubin is conjugated. I'm sorry, unconjugated. Put conjugated there, unconjugated. So most of the bilirubin is unconjugated. What does that tell you? Where's the problem? Before the liver or after the liver?
Before.
Before the liver. So keep going before. What is before the liver here? Problem where? Spleen, red blood cells, right? So if you have any autoimmune disease, if you're taking any drugs that actually are killing or destroying your red blood cells, your bilirubin levels will be affected. Does that make sense? And that will be high unconjugated bilirubin. If your liver is affected, then you're going to have what? Low conjugated. Does that make sense?
Mm-hmm.
Yes? Straightforward.
So like alcoholics.
So, what do we do with the bilirubin? Bilirubin becomes estercovilin or urovilin. What is estercovilin? Estercovilin, let me just use a little color.
Where are you? I'm not.
Right here. So, stercovilin here. So we use that bilirubin. Now, the bilirubin is becoming stercovilin. Esterco means what? Stercol, right? What does stercol means? Stiff? No. No. That's horse poop. Sterco, villain, stercol in Spanish. I mean, I don't know the other way of applying it in English. But stercol, villain means that is the one that colors your what?
Your food.
Feces. That's what colors your feces. Stercovilin covers your feces. Stool sounds better. Stools. Now, the urovilin, which is the one on top.
So that's why sometimes it's green.
You got different shades of color. If you get pink, don't run away. So, urovilin is the one that is what? Urovilin is what? That colors your urine. So your urine is usually what color, guys? Let's talk about urine and stool. Your urine normally is what? Transparent, light yellow color. If it becomes dark yellow color, you are what? Dehydrated. What do you do?
Drink water.
Because you are now what? Thirsty. I mean, normally you're thirsty, right? Or if you're not, your pee is, concentrated, then you drink water. If your urine is really transparent, white, what are you?
Very hydrated.
Overhydrated. What do? You don't drink water.
Exactly. So if you drink too much, it's bad for you. If you don't drink enough, it's bad for you.
That's everything in life. If you put too much salt in something, it's bad. If you put no salt, it's worst.
Wait, so if you pee clear, it's bad?
If you what?
If you pee clear, it's bad?
No, I'm saying if you're overhydrated. You should have a normal color urine. You're supposed to manage it out, right? Balance it out. Now, on the feces, when you actually go into number 2, the color of the feces is supposed to be what?
Brown.
Lightish brown, right? Kind of like a orangey brownish color, correct? If the feces becomes darker, like a dark brown, right? Or kind of like towards dark end, what does that tell you?
Blood.
2 things. If your feces are always brown, dark brown, like just brown color, that tells you that you have too much what in your diet?
Oreo.
Oreo.
Iron. Oreo. You have to eat a lot of Oreos. You have a lot of protein in your diet. All right? If your stools are towards the really dark color or black, that means that there's some sort of what? Bleeding in your feces. Okay? You don't want bleeding, because bleeding in your intestines, right, as the iron gets oxidized, is going to give you this dark color. Does that make sense? Okay. If your stools becomes green, that means you eat too much green things. I mean, sometimes you get black stools, but that's because you ate too much prunes or something like that, right? Something that has that color, like he said, Oreos, right? So if you eat like 3 boxes of Oreos, most likely your stool is gonna look like Oreo color, right? But if it looks green, that means sometimes you're constipated or you ate too much salad. If you eat too much salad, let's say you eat salad for 3 days consecutively, right? You don't eat a lot of anything else. I bet you whatever you want that your feces are going to be turned up some sort of like what? Greenish. Okay? So if you have white feces, like really, really light feces, what does that mean? So there's some sort of problem with the pancreas, right? And your liver. Because these things are not going through, right? The conjugated one. So you're not giving color. How are we doing on time? It's almost time.
A minute.
Okay, so yeah, going to say in a minute. So iron metabolism. The body stores iron, right, in about 65%, and that is in the liver mainly. Anything else? You have things that actually move the iron around, and that is what? Transferrin, ferritin, and hemosiderin. Transferrin, ferritin, and hemosiderin. That's what allows for the iron to be stored. So transferrin means what? Is a plasma protein that transports the iron. Ferritin is what? Is the protein that allows you to store it. And hemosiderin stores it. So how many of them can store it? 2. Ferritin and hemosiderin. How many of them can transfer it? 1. So if you see the word hemosiderosis, that means what? Hemo means blood. Siderosis is that is side blood that is depositing in your tissues. This is known as bronze diabetes. Look at that. You need to know what bronze diabetes is or what hemosiderosis is. Okay? So this is a lady that she lives in Alaska, and when she goes to the doctor, she's all tanned, and her glucose levels are high. And the doctor says, "Hey, you look tan. Have you been to Miami?" She goes, "No, I never left Alaska." So she looks like really tan. That's why the color says bronze diabetes, because you have a bronze color on your skin. And diabetes because it increases the chances of becoming diabetic, because as the iron deposits in the tissues, it actually damages your pancreas, as well as your liver and all the organs. Okay?